Hi everyone. I've received so many messages and emails to ask for an update on where I'm at. And this week was 6 months since I got back from Cyprus, which has gone so quick. But I thought this would be a good time to update you. Firstly, all the results that I spoke about in my 3-month post-treatment video, I am still seeing. Our digestive system is still working really well. Fatigue has improved from before I left to have the treatment, and just lots of little changes along the way. So still very happy with the results of treatment. I still have not deteriorated since before I left for Cyprus. So that is really exciting because it's been 10 years since I've been able to say that after that amount of time. So very happy with the results that I've had. For me, it was definitely worth going. There have obviously been a couple of setbacks along the way, which is to be expected. I've had 2 surgeries in the past few months. One of them was one I knew was coming. It is a surgery I have to have twice a year, and it is from the tick-borne illness, but it's something the treatment was always going to be highly likely to undo because the damage is permanent. My autonomic nervous system, which controls all the parts of your body you don't think about, has got some issues with my bladder. I've had that now for a couple of years. Basically, my brain sends the wrong signals to my bladder. The muscles contract at the wrong time, and it causes a whole number of issues. Something that we have found helps is to put me into surgery every 6 months and to have 100 units of Botox injected into my bladder. This relaxes the muscles and helps it work in a more normal way. I choose to have the procedure done under local anesthetic instead of general anesthetic. It is one of these procedures that is an option. You can have it done either way. I personally prefer to have it done under the local because I've had so many generals that it's a risk every time they put me under. Plus with the local, I can go sort of in and out much quicker. It only takes a few hours as opposed to a whole day thing. Basically what happens is they insert a catheter, the needle goes in through the catheter, and then the 100 units are injected into various spots across my bladder. For those who have asked, yes, it does hurt like hell, but for the sake of about 15 minutes while they're actually injecting it, the benefits far outweigh it. So I have that done twice a year and will continue to have that procedure done twice a year, most likely forever. Bladder stuff is not normally something I would talk about, but after talking to fellow patients who have the same procedure, they actually asked me to make a video about it because it's something that shouldn't have a stigma attached to it. It is perfectly normal. A lot of people have to go through it, and it's really important that it's spoken about so that people get an understanding of what can be done to help, but also that people are going through this as well. The second surgery I've just had done 3 weeks ago was to remove the infuser port out of my chest. The infuser port was put in literally 3 years ago now, and it was because I needed to have IVs so often and nobody could get a vein, and sometimes with my IVs they needed to happen quick, and it was taking up to 8 hours to be successful to get a line in, and when they did, my veins were just blowing. So the port was put in so that I could have my IVs done through the port in my chest to preserve the veins. Since Cyprus, I still need to have IVs, but just not as often as I used to. And because it's been 3 years since the port went in, the veins in my hands have now healed enough that they can normally get an IV much easier. The port blocked, and it's a danger. to leave it in, especially because I'm a huge clot risk. So the decision was made to remove it. It was a fairly straightforward procedure done by a vascular surgeon under general anaesthetic. They just cut my chest open, disconnected the tubes from my heart, pulled the one that was in my jugular vein, and then cut around the muscle that had grown over the port in my chest to remove the port. And then he stitched it very nicely back up using internal stitches, glue, and steri strips to hold it. I've been a bit sore now for a few weeks as I recover, because obviously they're cutting muscle and it's in quite an awkward position, but glad that that procedure is now done. That procedure was a milestone for me because it was officially my 21st surgery or procedure I've had done in an operating theatre since 4 years ago. So we decided, instead of being upset that I had to have yet another surgery, we would celebrate, because I've made it through 21 surgeries now. So we did have a little bit of a celebration for that milestone. I'm starting to look ahead now to next year, and very excited to announce that I have taken on a position working with WA Public Hospitals. I have officially been appointed to the Consumer Advisory Council for Rockingham Hospital, which is the hospital closest to me. It means that I am going to be a voice at the table at the hospital to give advice on the running of the hospital from the perspective of a patient, which is a great chance to be able to have a say and potentially make some change in the system as well, and make it easier for people like me that are going into hospital. If you can make that journey even just a little bit less stressful, then it will 100% be worth it. So I'm starting off just on the General Advisory Committee, and then there's options to progress and be trained onto further committees throughout the WA health system. So very excited about that coming at the start of next year. I do have another huge announcement coming at the beginning of next year, but I can't let you know what it is yet because it's still in the works. It's currently with lawyers and being processed at government level, but I will announce it when we get the go-ahead to do so. I'm hoping that it's something that's going to help make a difference for Lyme patients and their families in Australia moving forward. So that will be coming, I'm hoping, around March time next year. Both the Consumer Advisory Council and the other project I'm working on are things I wouldn't have attempted pre-Cyprus, but since coming back, I feel like I'm well enough to give them a go. They're not huge time commitments, which is an advantage for me because I'm obviously still not well enough to take on part-time or full-time work at this point in time. And the doctors have told me I possibly never will be able to do that. But at the moment, I'm wanting to keep myself busy, and these things will give me a chance to make a difference while also giving me something to do. So that's the update for now. I'm still progressing along really nicely. Thank you to everyone who has been messaging to check in. I still can't believe the number of messages I've been getting from people who know me and also complete strangers as well. I love getting your messages and being able to provide information for those of you who are asking. I will jump back on again once I can make the big announcement and as other things progress.